Jenny Pelicano. Today, I'll be discussing Echinococcus multilocularus. So, what is Echinococcus multilocularus? Echinococcus multilocularus is a cystoid that differs morphologically and biologically in its larval and adult stages from Echinococcus granulosus. The usual definitive host is the packs, with dogs and cats acting as sources of human infections in endemic areas. Echinococcus multilocularus is widely distributed in the northern hemisphere, particularly in Europe regions. Echinococcus multilocularus in Europe shown in a dark orange color. The morphology of the Echinococcus multilocularus, the adult worm is 1.2 to 3.7 mm. It has head, small neck, and body with 3 segments. The gravid fruglotet will be having an egg. The cyst is composed of many irregular cavities with little or no fluid with scoliosis. The cyst will be having scoliosis in case of human beings as their accidental host. We don't say the scoliosis inside the cyst. There will be central necrosis and cavitations of the lesion. The life cycle of Echinococcus multilocularus is complex, involving 2 hosts. The definitive hosts are foxes, wolves, dogs, and cats. The intermediate hosts are field mice, house mice, and ground squirrels. The infection transmitted by handling of infected definitive hosts or ingestions of contaminated food or water with the eggs of Echinococcus multilocularus. The other worm reside in the small intestines of the packs, dogs, wolves. The eggs progloted, which are passed in feces, will be ingested by intermediate hosts. The egg hatch penetrates intestinal wall. This ancosphere carried by blood to tissue, and inside the tissue will develop into the alveolar cyst. When the infected intermediate host is eaten by the dog, fox, the fructose collects from cyst. Man can get infected by eating the food, water, or directly handling the animals which are infected to Echinococcus multilocularus. Now, let's talk about pathogenesis. Liver is the common site. Cysts resemble a slowly growing carcinoma. Firm solid masses with poorly defined margin tend to spread throughout the tissue. Now we'll briefly study the pathogenesis of alveolar Echinococcus disease. Man gets accidentally infected with the eggs of Echinococcus multilocularus. The egg will hatch the small intestine, and the ancosphere will penetrate the intestinal walls and reach his liver through contact. Now we'll see the clinical features. In human disease can be divided to several stages. First, initial stages. The disease is spontaneous cure or progression. Ito ay di inaasahang pagtaas o pagaba ng kalubaan ng sakit ng walang malinaw na sanhi. And the second is progressive stages. Infiltrations. Ito yung maaring nag-uumpisa ng kumalat o lumala ang mga sintomas. Third is advanced stages. Will be having high mortality. Next is stable, parasite growth inhibited, then aborted, parasite dies, and C is calcified. Echinococcus multilocularus does not confer immunity to its host. And the diagnosis, we have imaging techniques, the MRI and CT scan, and tissue sections, homogeneous thin cystic structures of various dimensions were strongly PES positive or FAS positive. Signs and symptoms: nausea and vomiting, abdominal pain, weight loss. The treatment includes surgery. Surgical removal is possible as there is no capsule. Chemotherapy has to be given following the surgery. Mebendazole and albendazole are the drug of choice. Usually, the prognosis is very grim. Prevention by educating the children, strict personal hygiene, avoiding direct or indirect contact with the dog or fox species, and pet animals should be treated with persequenter.